I also just wanted to thank you guys so much for coming tonight. This topic for me really hits home as I suffered from compassion fatigue, burnout, PTSD, all the things. Working COVID ICU, definitely this topic is a huge one for me. So I just wanted to let you guys know that I support you and I completely understand everything, that we're all experiencing and going through. So I just wanted you to know that, you have people here and in support of you. And that is why we partnered with Emotional PPE and Kimberly today to provide this event for you guys. So I hope that it is, helpful and we can just provide some tools and some information for you guys. Okay. So now Kimberly's going to take it over.
Thank you. You can throw it to me. I want to thank everybody for joining. I know it's a Wednesday in the middle of the week, just towards the end of the day, and it's really hard for a lot of people to get motivated to join in. So I really want to thank everybody for joining in. It's a topic that is near and dear to me. So I am, as Britt said, I am with the Emotional PPE Project, which is an organization that came out of COVID. It started back in March of last year. The time flies for me. And I joined the board just this last July. However, I had the great pleasure of actually being among the initial clinicians that volunteered with the Emotional PPE Project. So if you're unfamiliar with it, and I'll talk about it a little later as well, the Emotional PPE Project was started by two neighbors, Dr. Ariel Brown and Dr. Dan Sadawi Kanefka. Both, Dr. Dan is actually an anesthesiologist at Mass General and is in charge of residents. And he came home, I think, one day and said to Ariel just how bad it was in the hospitals. And out of that moment of these two people coming together, sprung this 501c3 nonprofit, which actually provides a directory service for any frontline healthcare workers that are looking for free mental health services. And part of that free component is that we know, one, it's hard to reach clinicians this day. My profession is not either particularly good at returning phone calls at times, and often not particularly available. There's a lot of waiting lists. Additionally, it's a great way because of issues connected with stigma and concerns about actually reaching out, that this gives a nice kind of free, confidential way for people to start the process of dealing with compassion fatigue, PTSD, any of your COVID fatigue, moral injury, any of the other things we're going to touch on today. So with that said, as we kind of go into this discussion, I really hope that if you're in need or you know somebody in need of somebody to talk to confidentially, that you'll reach out or send them the Emotional PPE Project, or if you know any therapists who would be willing to donate their time and be a part of it, please also direct them to us. I've had the great honor of working with about 60 maybe frontline healthcare workers, and I will say honestly, probably 90% have been nurses. So just have to say this is a profession that does understand what we're talking about. And that probably comes out of the fact that compassion fatigue really did start in the nursing world in many ways. And the terminology of the word compassion fatigue, though it's been co-opted many times and we keep defining and remaking it into slightly different manifestations, came out of an article about pediatric oncology nursing. And that's Joinson kind of campaign was like 1982. So it has long roots in the field. So I am going to do my best now to actually share my screen. And let's see if I do this successfully this time. And here we go. I think that's it. So I really want to talk today about compassion fatigue and the impact of self-care and how the two kind of work together. Again, I'm Kimberly Johnson. I'm on the board of directors for the Emotional PPE Project. I'm also a professor for clinical mental health at Touro College and run a program called the Cash and Wheels Foundation, which is initiatives that provide anybody in grassroots community-based organizations that are healthcare workers that really help them to deal with these types of issues. I've been in the field since early 90s, dating myself a bit. I am originally from California, and I'm now greeting you all from Long Beach, New York. So I am on the other coast right now. So I don't know where everybody is, but hello, everyone. It's very dark out here right now. Kind of the things I want to talk about today. I really want to give kind of an overview of compassion fatigue. I'll try not to be, too didactic. I'm going to try not to lecture. It's very hard for me because I do it for at least 10 hours a week. But I do want to kind of give you an overview of kind of the terminology we're dealing with, of how kind of compassion fatigue is being seen today, and how it can impact you, some of the benefits of really being aware of it and implementing some self-care actions into your daily practices, how to know if you have compassion fatigue. We're actually going to go through kind of a list of symptomologies and consequences of it to give a sense of maybe where you are. And then I really want to end looking at some self-care thoughts before I push and encourage you all to reach out if you're really feeling the need to get there. So I'm going to introduce you to Max. Throughout COVID, this is pretty much what I woke up looking like, either externally or internally every day. And I suspect from most of you, this is a similar imagery. I don't know what it is about that face that just kind of speaks to me about some of kind of the struggles and stressors that we faced in the last about 2 years, and what many are continuing to face right now. We just somehow wake up looking like this and keep moving and keep going on. We might look great on the outside, but we feel like this in the inside. And part of what this discussion is today is starting to unpack this, to acknowledge and be okay with the fact that sometimes we are just a disaster. Sometimes we're just a mess. And how do we know when we're that way? And how do we know when to get a little help for that? So yes, his tongue is hanging out. My guy has no teeth. So that's where Max is. So as we get there and thinking back about our imagery of Max and our imagery of what many of you sit with in the professions that you're in, I'd like you just to take a moment and consider what your mission statement is. And what that means is, what brought you to this profession? What brought you to nursing? What brought, or whatever, healthcare profession you particularly are in, what brought you here? So what was it? What was a statement of what you wanted your career to be? And take a moment, and if you have a piece of paper in front of you, I strongly encourage you just write it down. What was your mission statement? What were those key words that you brought to this work? And as you think of that, think about how maybe that has changed in the last few years, or the last few months, or even the last few hours. Think about where you started and kind of where you are. Because our mission for the work we do is always changing, but there's always a few words in there that kind of are the root of the work we do. And they kind of speak to who we are as a character. It speaks to our perception of self. It speaks to things that we brought to the table that brought us here. I mean, we'll go back to this at the end, but take a moment and just think, what's your professional mission statement? And as you do that, and as you think on what that is, reflect on, I suspect for many, and I know even for myself as a clinician on my side, there's words that show up a lot in our mission statement. Words like wanting to help, or to be of service, or to put ourselves out there to take and maybe, alleviate pain or alleviate suffering. We want to make things easier for others, or we want to be a part of the healing that somebody goes through. These kind of particular words that often come up in our own mission statement, those really reflect on the traits that we bring into our work, and that make us really good helpers, that make us really good at the type of services we provide. But they also make us vulnerable. They're the things that really open us up to the vulnerabilities of the people we serve, of our patients. These are those particular words. And I'm assuming because you're helpers and caregivers and caretakers and nurses and people that come into this field wanting to be of service, that words like empathy and compassion and hope and help are really real specific traits of who you are. And in most cases, people that come into these fields come in already with those as personal traits. They're things we bring with us from our families, from our upbringing, just from our character and our sense of self. And in doing that, those specific things feed into what strangely makes us vulnerable. When we think of something like compassion, which is part and parcel of something that involves the concept of empathy, it really is a desire to help what is challenging somebody else. Being compassionate is something that we are sensitive to the suffering of others, that we're committed to kind of alleviating it, to preventing it, to mitigating. And in that way, compassion opens us up to the reality and the visualization and the knowledge of suffering of others. Now, as we talk about it, compassion also brings us up. There's this great release of oxytocin and dopamine that goes through our brain when we are practicing really positive, compassionate activities. And that does bring us up. That is actually a very positive thing. We want compassion satisfaction. But compassion in itself does open us up to that. So does empathy. So we need empathy to be compassionate, but empathy on its own really is opening us ourselves up and putting us into the shoes of others, into their suffering, into what they're going through. And empathy makes us feel with the other person. That really opens us up to their experiences, their traumas, their suffering, their successes as well. It opens us up to the feelings of others. And it's a way for us to kind of reach back to our own experiences or reach into something to help us connect with that person in front of us, what they're kind of going through. These are very important concepts of the work we do. And sometimes our empathy is almost, unconscious. You may walk into a store and see something happening and consciously respond and not even be aware of it. So there is some like almost intuitiveness in our own humanity to want to be empathetic to others. We also bring in this concept of hope, this perception that there are pathways to outcomes, to positive outcomes. And when we're really confronted in situations where we're empathetically involved and we're open ourselves up to the suffering of others and we're part of that, and we don't see this kind of pathway to hope or pathway to positive outcomes, that can really impact us because hope facilitates our resilience, facilitates our compassion. So sometimes that can also get in the way, but underlying, we truly do kind of speak, to the empathy and compassion stuff. So hope needs to be a part of that. And so herein lies kind of the paradox, right? The idea that those things that make us very good at the work we do, those things that make you phenomenal nurses and phenomenal healthcare providers are also what make you vulnerable to the traumas of others and also make us vulnerable to compassion fatigue and some of these other concepts we'll talk about. Viktor Frankl put it really nicely, and it's kind of the mantra of compassion fatigue is that which brings light must endure burning. The idea that being able to bring light, being able to bring healing and hope and, and care also opens us up to that burn. And it's important to understand that because that kind of burn emerges based on the impact of the traumas of others, added with our own traumas, our own stressors, and not just in the actual healthcare environment, but also just in our life in general. Because nobody is just one aspect. Most of us have also stressors and other type of traumas that we face in our personal lives, in our interpersonal relationships, in ourselves, in our own health. And so these are things that we actually also need to be aware of. And because we're talking about this in trauma, we know trauma has its roots in stress. And ultimately, we all knew going into the work we do, we would be impacted and confronted by stress. And that in this way, we kind of have to remember that there is a connection, there is a physiological connection to stress in our response to our patients and our response to our work that we can't just ignore because the roots of compassion fatigue reside in the roots of stress. And we know stress is not necessarily a bad thing. There are good components to stress. We wouldn't want to have too little stress because you couldn't react to the kind of work you do, to the crisis, to the needs of your patients. But there are places where we kind of can have too much stress. And that's when we start to get impacted and we start to go into those trauma responses where we move into distress. So eustress is kind of that lovely place where you have optimal stress. You're neither too laid back, nor too overwhelmed or too overloaded. But we do want to also be hypersensitive and hyper aware to the de-stress, to that harmful stress. And
Hey,
this,
Kimberly, I'm
yes.
so sorry to interrupt. The slides aren't going with the presentation.
Oh no, where are we? Where are you at?
You're just on the first one, the first compassion fatigue one.
Oh, that's so funny. I'm sorry, guys. Let me see if I can get it. I am on.
Yeah, there we go.
You
Yeah, I don't think it's I think it's like it's not presenting for some reason. It's like it's in still in like an edit mode, it looks like.
Yeah, on mine it's presenting that. Let me open it in as a full and see if I can open. I'm sorry, y'all. Let me see if I can get back there to that.
Apologies,
Um,
guys.
I do, yeah, when I do this, I still have to share it for you guys though. That's super strange. Bear with me. It was working well for me. So you guys didn't get to see your picture of Max yet. That's very unsettling. Let me see if I'll just share my full screen, if this will help a little bit. So let me do this. Mhm. Okay. Can you see everything
Yes,
now?
perfect, perfect, perfect. Thank you so much.
I'll just let everybody see Max again because you got to see how he looks. Because honestly, that's how I feel most mornings, and I suspect some do too as well. All right, so that's Max. I talked about it with you. We talked about the mission statement. We talked about this, and here we are. Thank you for interrupting because I would hate for me to keep going and for you to have to just stare at that front page. So when we talk about stress, and we're talking about the Yerkes Dodson law of how stress looks, this gives you a nice kind of overview of where stress may be. This gives you an overview of the concepts of when we move to distress, when it kind of takes over our life, when the stress and the anxiety, and be it our own response or that we're taking into others or that imposed on us by our environments, when that kind of gets in our way. And it also talks about all the different ways it impacts us. That it needs not just impact us kind of on superficial, it impacts us across all parts of our life. And when we get into that kind of catastrophic stress, we get into that part where we start to burn out, when we start to have our bodies overwhelmed and we can't keep going. When our body tries to rebalance and tries to reduce the amount of stress, when we have a hard time continuing, is where we start to have that kind of traumatic stress. And we start to really, that manifests itself in all areas of our life. And that's when we start to talk a little bit about compassion fatigue. And that's where we move into, post traumatic stress disorder. That's when we start to see those type of symptomology. And kind of because trauma is stress based, has a lot of internal functions, and it is based upon our autonomic nervous system and the arousal regulation and trying to rebalance the parasympathetic and the sympathetic nervous system. And so, how we kind of respond and deal with our stress will be very important. But the first thing is to understand kind of what we're going through. And it is true that most providers and most healthcare workers already have come in knowing that they're going into a stressful environment, that they already are prepared for it. They've been to school, you all been to school, you know what stress is like. Most have already acknowledged this is going to be stressful. But we are at times, and particularly in these times, confronted with unprepared for stressors, unprepared for situations that have kind of even made us more vulnerable to what we're dealing with. And the best part of this is we all have 1,000 statements and ways to kind of intellectualize and kind of brush off the stress we're confronted with. I should be able to deal with this. My coworker is dealing with it. I can. If I feel overwhelmed, I feel stressed, it means I'm weak, and I'm not weak. All stress is bad for you, which we know is not true. Some stress is really important. I particularly don't want to drive with somebody that has, no levels of stress, because I'd like them to respond if things go, a little bit haywire. I don't want them to be on the other end of the stress spectrum, but there are some levels of stress that are particularly important for us. Or the best way to deal with it is just to ignore it and would go away. For many of you, and you may have sat with this, if we ignore it, we press it down and it still sits down there, and it makes our fuse even shorter. It makes our resiliency even more compromised. There's nothing you can do to avoid stress. It's just part of life. Well, that's true. There's nothing we can do. It is part of it. But we can minimize it. We can mitigate the impact it has on our daily life. And part of that is being able to be aware of it. And we can also learn skills to kind of reduce its impact over time, that we can learn skills and learn techniques that we know we will be overwhelmed, but we can implement them in the moment, either on micro levels in the second we're feeling it or ongoing as a way to kind of help us cope just generally in life. And that idea of no symptoms, no stress. That's another one that we know is obviously you don't have to have symptoms to be stressed, but also we're pretty good at ignoring our symptoms. Most of the time we're pretty good at overlooking that which we're actually experiencing or to minimize it or intellectualize it away because boy can't we all understand why we're feeling what we're feeling. But when we ignore it, it does have a deleterious effect on our body. It does impact us long term, and it is something we want to continue to be aware of. So, just to lighten it a bit, I love this one because, you know, we all kind of have our hard edges sometimes, and sometimes we don't always acknowledge that I think I'm a circle, but I'm still functioning as a square. So, taking a moment to really be aware of what we're going through and where we are in the stress is very important. So, keeping all this in mind, that we have our own stress. For all of you here, there's also the stress of working with people that are going through trauma of their own. And this is kind of where it comes down to the concept of what we're talking about compassion fatigue, where we understand that trauma is a part, has stress base. But what happens when we are working with people who themselves are going through traumatic experiences, emotional, physical, whatever it is? How do we deal with the experiences of the people that we're working with? What does that look like? And traditionally, we talk about this as being this idea of contagion. So this emotional contagion, the idea that when we are open and empathetic, when we're being compassionate and open to the suffering in others, we start to take on a lot of the traumas and we start to experience the emotions and the stressors that they're going through. We start to internalize that as well. And again, we go back to that idea of empathy and the idea of taking in the pain and feeling of others. And that starts to resonate with what we go through, even if it's unconscious. And so we start to be traumatized by concern. And in my field, we do a pretty poor job of all agreeing on the same terminology for any type of construct. So there's a number of different ways that we kind of talk about this experience, this idea of being, of taking on the traumas of others in the work we do. As I said before, compassion fatigue itself kind of comes out of the early 92, I guess 92, of the work even within the nursing field, this idea of the cost of caring, which kind of got piggybacked on by a number of other theorists, including Charles Feigley, who's kind of, we call him the grandfather of compassion fatigue within my field. But there's a lot of ways people the terms they use, savior syndrome, co-victimization, emotional contagion, proximity effect. There's a lot of ways we start to talk about the kind of feelings, the kind of impact that working with people that are going through traumatic experiences or crises, how's that impact us as caregivers? And the idea really comes down to now talking about it in a couple different ways. So secondary trauma or vicarious trauma, you may have heard these kind of terms before. Secondary trauma means trauma that we take on from other people as opposed to our own trauma that might be considered primary. Vicarious trauma tends to be kind of the cumulative effect of secondary trauma, where you may have the resiliency with one patient to deal with the traumatic events they're going through or their own kind of depressions or grief. But as it starts to accumulate, it changes. It starts to accumulate inside you. So that becomes more that vicarious trauma. And that's kind of that over in the residual effect of kind of witnessing the pain or the fear of the traumas of others. This kind of leads over time to something that they've termed secondary traumatic stress. This is a term they started to use particularly for caregivers that were a little bit more resistant to the word PTSD, even though the symptomology is very much the same. So secondary traumatic stress is often kind of utilized as the same as compassion fatigue. So secondary traumatic stress and compassion fatigue really do, when they start to look at it, share the same symptomology as PTSD because it has the same impact on us physiologically, psychologically, emotionally, etc. It does really start to impact us. over time. And so compassion fatigue is kind of like all that put together in one little picture now. The idea of compassion fatigue came out and really started to be part of a lot of the discourse. Now, I'm sure if you go onto any of your professional sites, there's discussion about it. If you put in compassion fatigue in nursing, everything comes up. There's a lot of research being done. This idea of compassion fatigue, and I'll give you a nice kind of definition that I like to use in a moment. But over time, it's that the emotionally that's our response to the emotionally charged situations that we're kind of confronted with. And it can be impacted by poor resources, the environment in um, which we're working, our own traumas. It is often it becomes worse and worse. It grows and picks up speed based upon everything else we're going through as we get overtaxed, as we get exhausted. No matter how much we're practicing self-care skills, sometimes we get overwhelmed. And through compassion fatigue, it really becomes this kind of erosion of everything that connected us to caregiving. It starts to erode our hope. It starts to erode our trust in others. It starts to make us a little bitter at work and makes us kind of disconnect and want to dissociate from the work we do and the people we serve. So as things kind of snowball out of control, it starts to really undermine the true root of the work we do, of who we are and of our own character. And you see this kind of like term empathy strain here. This is starting to come out in the discourse as well. I just wanted to put it there just conceptually so that word sits in your head. Mainly because, I said before, compassion itself, it rejuvenates, it's positive, it releases, good neurotransmitters like oxytocin and dopamine, and it kind of helps to alleviate some of our stress. And it is a much more positive thing. Empathy, on the other hand, the more we're open to the traumas and the stressors, that starts to get strained. And that starts to impact our neurological functioning, some of our cognitive functioning. It can start to increase our vulnerability to stress. So empathy strain is something they're kind of moving to in some areas as opposed to compassion fatigue, because they think that it captures a little bit more of what most people are starting to deal with. The really having a hard time to be empathetic to what other people are going through because of the cumulative effect of the experiences. Now, none of these are burnout. We'll kind of touch on that a tad later, but this is when we start to talk about empathy or compassion fatigue and empathy strain. So I like this kind of definition. This comes from the Compassion Fatigue Awareness Project. I have their actual website there if you're interested in connecting with them. They have great resources and some really good kind of self-tests, etc. But compassion fatigue for them is broadly defined concept that can include emotional, physical, and spiritual distress in those providing care to another. It is associated with caregiving where people or animals are experiencing significant emotional and physical pain and suffering. So this is how they define compassion fatigue. And again, whoops, I went a little far. The paradox remains, and this is what's particularly interesting, is that we are seen as compassionate when we work with those who have been traumatized. But in working with those that are traumatized can have a deleterious effect on us as the care provider. So it is kind of that double-edged sword of doing the work we do and still being vulnerable. So compassion fatigue and empathy strain, I want to talk about the picture of it. So you start to see where you fall. Where are you in this kind of concept? So, compassion fatigue is the response is individual. It is not cookie cutter like most other things in this world. There is no one size fits all on how it looks. It happens across a continuum of kind of low grade kind of symptoms to full blown symptoms that look just like PTSD and probably in most cases move into that PTSD diagnostic kind of picture. It's dependent on the situation and it's dependent on your vulnerability at that moment, how much risk you're facing, what the buildup. I mean, quite honestly, in the world of COVID, for so many, it's just this ongoing thing that it never stops. And so there is never a break. And in that can cause even more compounding of vulnerability. It has is very much impacted on your own self-care and your own self-awareness. And it does vary for each person each time. So you may have gone through some traumatic and horrible and very overwhelming professional situations and did not come out on the other side with compassion fatigue. But it does not mean that you may not at some time. In fact, in most cases, we say those that are the best at what they do are the most vulnerable for compassion fatigue because they do put themselves out there the most. They are most open and most empathetic and compassionate. And so we do need to keep in mind that we're always at risk for kind of falling into this. So as we get into the type of things we look at when we're looking at the traits of somebody that is vulnerable, we look for people that are highly dedicated individuals. We're looking for people who are the best and the brightest because these are the people that are the most goal oriented and are often confronted the most when there is a lack of hope or when things are not going kind of in a more optimistic or positive way. As I said before, most of us already came into this field with some symptoms of compassion fatigue because of our training and the work we do and who we are and how we put ourselves out into the field. And most of us also come into this kind of field with this idea of other directedness, meaning that we are taught to care for others. We're taught to care for those around us, often before we care for ourselves. And in that, there is this kind of lack of self care practices that have been kind of instilled in us throughout our lives because we're so focused on others. So that becomes some of the traits we look at. There's that low self compassion, the ability to work to achieve results even at risk of ourselves, to work long hours or take extra shifts or do what needs to be done because we put ourselves out there. We might be able to identify with the people that are going through the traumas that will often lead us there. We may have poor boundaries or be a little overly involved at times. We may have our own poor health, mental health, physical health, interpersonal relationship health. Those may be part of it. And that avoidance of help. The avoidance to ask for help is another trait we often see of those that are most vulnerable. We see that often with people who assume that they should be able to deal with the stress and that somehow asking for help is a sign of weakness. And that in and of itself is one of the biggest kind of stigmas we often confront with this. So we have to always consider our own histories. What do you bring to the table? What type of traumas do you have that might be, unresolved or undealt with? What things might you need to deal with so that you're healthier in dealing with the traumas of others? What does your exposure look like? What are you confronted with on a daily basis? What's your proximity to the trauma, to the crisis, to the emotions, to the experiences of others, and what's the distance, and to what degree, for how long a period of time? What's your level of empathy? What's kind of how much do you put yourself out there? Quite honestly, in most of us, when we start to see that we have a lack of empathy in doing the work we do, that's really the moment we want to pull back because it's a really good sign that we're in compassion fatigue and we need to pull back because empathy is such a key component of the work we do. What's the environment you work in? How toxic is it? How supportive is it? What kind of environment of self-care is promoted? How much is there collegial kind of support? Who do you go to? Who can you go to in the environment for that kind of support? And what kind of like outside things you do to kind of support that as well? And what kind of preparation? How much is self-care been kind of part of the dialogue of your education, of your work, of your professional and personal preparation, and your professional and personal identities? What kind of trainings have you had? What kind of things continue to be part of your life that build you up and keep you healthy and keep you strong? We look for those. We also look for other kind of factors such as, your own kind of stress management techniques and your support systems and your own spirituality, whatever that looks like, however that looks like. What kind of things connect you and keep you going and keep you strong and safe? What's your workload look like? What's your use of supervision? These are things that come into that as well. So, we're not immune to pain in our own lives. So we need to continue to look at how our own lives impact and bleed into the work we do as well. We talk about some risk factors. These are other risk factors to keep in mind. High caseload demands and workaholism, if those are part of what's going on with you, those are risk factors to check off and to note. your own personal histories of trauma, which we touched on before, um, self-awareness, social support networks. So social support networks are very interesting, particularly if your social support networks aren't in the same work as you, don't understand the work you do, understand your commitment, or understand the impact of your experiences. So often we really encourage the idea of looking for support systems that also understand support groups, connections with peers. You know, go have a picnic someday with somebody that's in your field so that there can be that shared kind of experience as well. Some of the consequences of compassion fatigue we will get into. I'm going to give you a list and you can go through and see if you hear yourself. But overall, compassion fatigue does impact how we view the world, our worldview. How safe do we feel? It impacts symptoms, the things we experience, the PTSD like symptoms, our physiological kind of well-being, GI issues, your immune decreases, your immune vulnerabilities. It impacts things like aches and pains, um, poor sleep. There's headaches. There's a lot that goes into that. It can impact our relationships with others. There are a lot of consequences of not dealing with compassion fatigue, one of which is also the ethical consequences, because we know that, the increase of compassion fatigue, the increase of this poor kind of working condition, our ability to kind of function, it impacts our performance, it increases medical errors, it decreases empathy, it impairs our competencies, it encourages people to leave the field, which again impacts the care we're able to give because of a diminished workforce. And then it's also impacted because we'll explain it away and we won't deal with it. And that compounds the ethical concerns that we need to hit. And quite honestly, when compassion fatigue kind of hits critical mass in any workplace, the organization where we work suffers, the workforce suffers. People start to be absent a lot. A lot of people are out on workman's comp, or there's an increase in injury on the job. There's high turnover rates. There's a lot of more systemic issues that we're confronted with, and additional stressors on the workers. And while this is not the same as burnout being kind of that cumulative effect of a kind of dysfunctional and not supportive environment, this is kind of that situation where if we're not dealing with each other's compassion fatigue on our own, and if the systems and where we work aren't dealing with it, then the burnout rates come much higher. And we've seen a positive correlation between these kind of compassion fatigue and secondary traumatic stress reactions, and people not staying in their careers, and people leaving, and this increase of burnout. So take this moment, and I'm going to go through it. And this is a wellness wheel, and I've kind of co-opted it for compassion fatigue. Thinking of yourself in any of these areas, I'm going to read some of the symptomology that are associated with compassion fatigue. And take a moment and see where you are. We talk first on the cognitive areas. We're talking about a lot of cognitive shifts, things like disassociating. So pulling away and often feel like you're kind of looking at what you're doing or your work or yourself from the outside. Changes in how you believe and your expectations or your assumptions about the world, like a decrease in safety, the idea that the world's no longer safe, or there's no hope, or nothing's going to get better. Difficulty concentrating or being easily distracted. Intrusive thoughts or flashbacks, as if you're experiencing again. Drastic changes in your worldview, who you trust, who you don't trust, what you believe in, the ideas of if there's ever hope. Diminished sense of self-worth. Cynicism or bitterness, you find that creeping in. Increase of nightmares. Dependency or trust to reveal, the suspicions of others. So you either more dependent on others, or you go on the other side and you're more suspicious. There's this chronic suspicion of others. A heightened sense of vulnerability. Extreme sense of helplessness, a sense of loss of personal control, some loss of freedom, to feel that you no longer have a say. Think of those, from cognitive. Emotionally, increase in anxiety, of this kind of negative arousal, always being anxious, feeling at the drop of the hat you could respond to something. Or the total opposite, complete numbing, where you avoid feelings, you withdraw from things. Maybe low frustration tolerance or irritability. This kind of grief symptomology, feel like you're going through grieving and maybe not even being able to pinpoint exactly what you're grieving, but you feel like there's this constant sense of sadness, of grief, of loss. Anger and rage. These are something we often kind of avoid, but anger and rage are big. Guilt. And this can be guilt as much, either guilt of not doing enough, guilt of being there, or even witness guilt. The fact that you were kind of a survivor that's re experiencing the traumas of others. Depression, sadness, dread or horror, fear, shame. Maybe you didn't do enough. Maybe shame that you're feeling what you feel. Physically, we're looking at things like headaches and GI problems, insomnia, or some kind of sleep disruptions. Or even I work with somebody that just really kind of lives out her entire traumas in her sleep and thrashes around. Decreased immune response, lethargy, being more accident prone, maybe increase in injuries, changes in eating habits, aches and pains, heart palpitation, like strange kind of body regulations, more hot, more cold. I often will get, the palms sweating, or not understanding why you may have that heightened sympathetic response at the moment. Social and impersonal changes, things like difficulty separating work from your personal life, or being angry that your personal life doesn't understand or doesn't respond because of what you've seen in your work life. Interpersonal conflicts, pulling away or diminish support system, where you start to push people away or cut off relationships. Overall, difficulties functioning socially, not wanting to go to social events, pulling back. Blurred boundaries, not kind of knowing you end and maybe your patients begin, or the families you work with begin, having really blurred boundaries. Resentment of others, struggling with trust or intimacy, withdrawal from family, friends, or colleagues. These are big ones. Pulling away from your social supports. Some of that is because they don't understand, which is something that is a common feeling, and that does make sense. But in pulling away from all social supports and not gathering onto something becomes problematic. Some of your behavioral kind of symptoms, something we call the silencing response, where you find yourself shutting down, redirecting, or minimizing when somebody talks to you about something because you don't want to hear it because it kind of starts to trigger. So also the idea of distancing or isolating yourself, or avoiding certain kinds of triggers or people or situations or discussions. I did work with one gentleman that would avoid one specific room in the ER because it tended to be the COVID room, where a lot of the poor outcomes were, and he couldn't walk in there without having strong emotional responses. Hypervigilance, always be ready for the next thing, always ready for the next bad thing to happen. Aggression, a return to self-soothing behaviors, be it smoking, drinking, overeating. Some of those can be over anything, doing anything compulsively that you may have already stopped or reduced. Missing important commitments, forgetting appointments, avoiding those. Overworking, believe it or not, the totally opposite, working too much can be one of these symptoms. Finding you're using a lot of sick leave, absenteeism or attrition, kind of moving away from the job and finding reasons not to go to work or not to be involved in situations that might be triggering. As I said before, substance use, looking to change careers or change jobs, and hating the work you do, and always sitting there the entire time at work, kind of going over that. Not using supervision, avoiding using supervision. Chronic lateness, a lack of dedication or follow through, and as I said before, some of the avoidance behaviors. Environmentally, this is almost on a bigger scale, not seeing where you fit into your world anymore, and not seeing how your world is fitting you in. And that starts to be not seeing kind of the bigger picture of your system. And on the spiritual side, starting to question, be it your deity, yourself, whatever spirituality you have, starting to feel that kind of sense of hopelessness, of not seeing there being any improvement or any light. Skepticism of meaning. What's the meaning of all this? And it can be often pulling away from those kind of spiritual activities you previously engaged in. If this talks to you, these are symptoms of compassion fatigue. And some of them are even more significant. Some are so impairing that you need to actually be in treatment to be able to continue to function in your daily life. Some of them may be just very annoying in parts of you and how you're functioning that you're somehow managing, but these things can start to accumulate. This is a very great site if you really want to start to take a self-test in compassion fatigue. So the ProQual is a measure that was done by, I believe it was Beth Stam. And this is actually an online, you can take it. It's done in many different languages. If you know people who speak other languages that this might be useful for. And it's a self-filled kind of measure that looks not only at compassion fatigue, but also the compassion satisfaction, which we want to kind of build up, as well as burnout and workplace trauma. It's a very great place to start to get a picture over time of where you're at. I didn't really send this out to people, but it is something you can go there and use. It's a really nice site for that. Additional things I do want to touch on because they're real. These are other things going on for many people right now. And you may not have compassion fatigue, but you may have COVID fatigue. What does happen for many in the healthcare field is that while they're dealing with compassion fatigue, the people they know are developing COVID fatigue, and they're not being particularly sensitive to the compassion fatigue and the PTSD that people that are still dealing with COVID are confronted with. And so that sometimes can be conflictual. But this is kind of that survival of COVID. It starts to erode, our resiliency. And quite honestly, COVID is one of those unique situations where people have been in this state of constant elevated response for months and months and months and months and months on end. And that does start to overwhelm the system. Moral injury is something else we talk about right now. And this is where kind of our moral conscience and our kind of values are impacted to injury, resulting in some kind of decisions we have to make because of some transgression. And this can lead to anger and sense of, self-betrayal or betrayal of who we are. And it can be very profound because it starts to be very disorienting. Having to make end-of-life decisions or make healthcare decisions that may not be in line with our moral kind of compass can speak to this. And I know many probably have confronted with situations that had instilled a sense of moral injury at that moment. Anger is another one. For so many healthcare professionals, there was this period of great clapping and cheering, going to work, that has now in many cases been supplanted by booing and derision. And that anger and being angry at others is something that many are feeling. Instead of kind of explaining away, it is something that at times we need to kind of sit with and process and being able to voice. We often kind of avoid being angry or somehow minimize it, but the anger is real. For many, the anger itself is, it's part of the rage and part of the anger of the compassion fatigue experience. Caregiver syndrome is something else that many of us kind of are confronted with because we are caregivers everywhere, right? There is no place probably for many of you where you can step away from being a caregiver. You're a caregiver at home, you're a caregiver at work, you're a caregiver with your friends. And that caregiver syndrome, is real. We're not caregiving ourselves. We just kind of, it becomes a snowball. And so we are attracted to the field because of it, but it also can exacerbate our compassion fatigue experience. And you start to notice people and ourselves as caregivers. It's something that we have to kind of reflect on and see where do we stop being a caregiver to others and being a caregiver to ourselves. And then burnout is real. I think probably most of you have been in situations where the burnout, because of the systemic issues, because the environment in which you work has been not the healthiest, or it has not been the most supportive. And so as we look at it, this is kind of burnout is cumulative. It's based on the environment. It's based on your supports. It's based on how much say you feel you have, how much investment you have into where you are working. And that, I think, is very specific. And it's not, even though that and compassion fatigue go hand in hand, Burnout is one thing, compassion fatigue is something else. Compassion fatigue makes you more vulnerable to burnout, but you can burn out without having compassion fatigue and vice versa. So as you think about this and you think of where you are right now, let's think about what keeps us well. Let's think about something more optimistic. We always talk about what's broken. We're really good at seeing where all the problems are, what's broken. But what is working? What keeps us healthy? What keeps us going? What keeps us connected and compassion? What gets us back to the root of our empathy, gets us back to that gratification of the work we're doing? What connects you back to your mission statement? What gets you back there? How do we kind of move forwards? What kind of things feed compassion, satisfaction, as opposed to the fatigue, as opposed to the empathy strain? So we talk about compassion, satisfaction, and embracing that. We're talking about finding pleasure and kind of those satisfying feelings and helping others, being able to, kind of connect with why we got into the field in the first place and those empathetic attitudes for others, and being able to go back to, really assisting and alleviating the difficulties others face. So compassion satisfaction is what fuels the work we do. It's the good, it's the positive, it's what we want to promote. And ways we kind of promote that, when we promote things to keep us well, is really starting to be aware of those things that make us happy, that feel successful, the ways that make us happy in the work we do, that makes us happy in our social supports. And it's the way to kind of work away from work drain, to work away from, to bring back the hope. And so we can make and perform safely and ethically and with satisfaction the work we do. Some of those ways we do it are some of these actions, like being self-aware and being able to self-assess, being able to know what your strengths are, to know the areas you can improve on. I don't like saying weaknesses, because I think weaknesses are only weaknesses if we can't improve on them. So where could you be better? Where could we do that? That's self-awareness and self-assessment. Understanding our levels of stress and how we function, our ability to be aware of it and seek support. That's where therapy comes in. That's where peer support groups come in. That's where supervision comes in. Being able to reflect back and be open to know us and to self-assess at any given time and see where we may not be super aware. The idea of knowing what our compassionate identity is, this kind of our GPS of, where we are in being compassionate to others. And being able to have a sense of that identity can help us to know where to seek support. Knowing our own hardiness, our own resiliency skills around connecting with our sense of control. That becomes that self-awareness. And then really knowing our support systems, being able to promote healthy support systems, not those we sit around and kvetch and like argue with each other and find a way to what I call slime each other, where you think that's bad, well, I have it bad too. Those are great places to decompress, but we need to have also those social supports that help us be better, that help us to have positive growth, to be self-aware, to be able to find ways to minimize the burnout, to minimize the symptoms of compassion fatigue, and to build up our compassion satisfaction. We have to practice mindfulness attitudes. Now, mindfulness is a big catchphrase this day. I don't know how many of you practice mindfulness activities, but mindfulness is it's very popular in current kind of literature and the movement. But what we're really looking at is kind of this in the moment, non-judgmental self-awareness, being able to be kind of open and receptive to kind of how we approach our life in the now. So those can be all kinds of different ways of being involved, but that's to bring us not in the what ifs, not in the should haves, but into the here and now moments to help us utilize certain type of mindfulness activities that helps us to be calm, to kind of come back, to reground, to rebalance. Those types of things we find that lowers those kind of integration of mindfulness attitudes can lower levels of burnout and significantly decrease compassion fatigue. At the same time, it's also knowing our coping strategies. How do we cope? What are our lifetime coping strategies? And have you found that that becomes something we fall back on. When we're comfortable, we fall back on coping strategies in the moment we're really confronted with some type of stressor or some type of increase in our responses. And so we fall back. Are they healthy or are they unhealthy? Are they building you up or are they bringing you down? They're keeping you stuck. Do they involve self-blame or distraction or denial or avoidance? Or do they help you actually cope through the situation and come out the other side to keep you moving forward? And then really looking at cognitive perceptions. How do you look at the world? Are you optimistic? Are you pessimistic? I mean, there's a very big move now towards trying to promote positivity. And for some, it's like, how can I be positive when I'm faced with this? So, what are you doing in your life to kind of promote and find those moments of positivity? Being able to find and kind of confront those perceptions and negativity, at least in it, to be realistic. You don't want to be, have toxic positivity because it's not healthy either. But being able to look at what you're seeing and at least balance, to at least find at least the minimum one positive statement for the negative statement. They say the optimal to thrive is like 1 to 5. So every 5 positive statements to 1 negative. But even if it's just a small step to kind of start to balance that out. And that can start to help alleviate strain. And lastly, the I concept of self-care. This idea of looking at how self-care becomes part of your life. Pincus in '06, and I really like this way of conceptualizing self-care. Looks at kind of as something that what you do to improve your kind of sense of subjective well-being, a way to obtain some positive rather than negative outlook in life. And it's not the same as resiliency. Resiliency is your bounce back. Resilience is something that is organic and grows through life. Self-care is something that's practiced, something that's you've done, is something that we can look at both a micro level, like small, integrate into your life, and on the macro level, the bigger things that you do. So self-care is something that can help us to be aware of our own distress, alleviate it, or mitigate it when it's overwhelmed. And so we really want to push towards this concept of the culture of self-care. There is benefit here. It improves your wellness, your physical well-being, your healthfulness, your self-awareness, your satisfaction. I mean, there is a benefit to the idea of self-care. And it should be central. It shouldn't be something you just kind of do peripherally. It should be something that is in, part of your life. And not just part of your personal life, but it should be something we should be pushing towards this in our workplace too. And this idea that well, if you're burning out, it must be your fault, is this idea of passive blame. We have to look at systemically that self-care has to be part of the whole picture. That self-care goes from this top down, bottom up way, that it's not just people on the work side that are burning out, but even our leadership needs to know that it's not just, well, if you're burning out, you're not doing enough self-care. And we need to look at it systemically. There needs to be a culture that promotes self-care, that allows for this to be part of the discussion. And this isn't just like, okay, so we'll send everybody on vacation. But this is a way that it promotes kind of those interpersonal relationships where self-care is part of the dialogue. That it's not like, well, you're not working enough. It's looking at more of the balance of being able to balance both the needs of the organizations and the needs of the individual. It also has to be part of you and your culture, what happens in your professional culture, what happens in your own life. It is something that does promote well-being and is organizational. Self-care can come down for things like peer support, as I talk about. It can come down to actually being able to take lunch, being able to just sit and breathe for a moment. There's a lot of ways that can promote this idea of self-care, but it's something that needs to be central, not peripheral. Because quite honestly, it's very almost impossible for any of us to do the work we do if we're not putting on our own oxygen mask first. There's a reason why they do this on airplanes. There's a reason why we don't do this in the work we do, but we should. And there's a lot of great analogies of what we have to do out there. We don't have to give until it hurts. There is something, we have to bank some stuff for ourselves. But this, I think, conceptualize finding a way to put on your own oxygen mask, because self-care is unique to you. It is individual, as personal as yours. And we have to understand that it is something that is, how we respond. We need to take an active control of this. We learn it by doing, we learn it by practicing it. We, we, it's the idea of somebody may come up with an idea for self-care. And we're like, oh, I don't need to do that. I'm fine. Great. Well, I thought that about asparagus too. Now I always thought I don't need it. It's disgusting. Now I love it. Well, I just had to try it sometimes. So sometimes, trying stuff to see if it will work. It may not. You may hate asparagus, but at the same time, taking that moment to really try it. And checking, self-reflecting, see what fits into your lifestyle, continually checking in. You might try something for yourself, something very small, like finding some kind of anchor object at work that every time you touch it, it reminds you that, you're grounded, you're here, you're now. That might work or might not work for you. There was somebody I worked with that wore the same shoes every day, for his shifts. And their goal was to look down at his shoes and know that there was 2 feet on the ground, that he was planted, he was there, he was stable. There was a foundation. And just looking at the shoes reminded him of that. And that worked. It may not work for everybody, but he constantly checked in to see. And your self-care should be intentional. You should do it intentionally. You should do it actively, not in response when things go bad. It should be something that's constantly done, knowing that this may be a hard room to walk into. This may be a hard patient to look at. This may be a hard day. So I'm going to intentionally utilize things because I know. I'm going to do it intentionally because it's important for me. And it should be something that's balancing, that gives you this kind of awareness that is part of balancing work to life. What's your transition from your job home? What do you do? How do you transition? How do you leave work there and know you're going home? I know somebody that wears a hat on the way home every day, takes the hat up, hangs it up right at the front door, literally takes his hat, changing it up. He's leaving his work at the front door. How do you go home? What do you listen to music? Do you have a song? What brings you up? And confronting your own dysfunctional thinking, your own moments, those self-assessments of judgmental. I coulda, woulda, shouldas. I didn't do enough. I should have been better. All those things we do. There's a great famous saying by Albert Ellis, and he keeps telling people, stop shoulding all over yourself. Don't should. Start confronting some of that and looking at it and realizing, what you are doing, where the successes are as well. And kind of on top of that also is being open to this idea of vicarious resiliency. Look at how resilient some of our patients are, some of our colleagues are, some of our friends and family are, and take that as inspiration for our own resiliency to find hope, to find better, to find stability. Acknowledging how stress has changed you. Sit into it. Know it's there. Don't avoid the fact that we have been forever changed by the stress that we've gone through and the experiences that we have. Know that it's okay to speak to somebody. Know that it's okay to have that moment, to put it out there, to be the center of attention for somebody else, to let somebody else care for us. And then think about self-care on many levels, not just the macro level, the one we always think about, go on vacation, join a gym, run a marathon, the big stuff. Think of it small. Think of it also on that kind of macro level. And this is, micro level. This is really great kind of concept, this idea of thinking about things you can implement in your life on a daily level. Like when you're just waking up or you're just going to sleep or you're starting work or finishing work. Ways that kind of balance self. Things that are, looking for something that brings you joy in every moment. Look for that one thing that makes you smile and note it down. Look for an anchor object, something that you carry in your pocket with you at work that reminds you. If you wear earrings, a necklace, a bracelet, a watch, something you can touch that reminds you. When you're starting to feel burnt out or feeling overwhelmed, taking your hand and just putting it on your chest and letting the weight of your hand connect with kind of the seat of your compassion, that place where you are. Things like a digital detox, stepping away from social media, which for some people causes them even more anxiety, I know, but sometimes just stepping away from that for a moment and not being there. Coloring books, little things that might be something you can do that can be in the moment. And the big one that we always talk about, the concept of laughing. Finding something to laugh at. Not something to laugh at, but something to laugh with. Let's put it that way. So laughing at others. But the idea of finding moments to laugh, to have that laughter in your life. There is good things that happen physiologically from laughing. And we as adults forget to laugh. Kids laugh so much more than we do. We forget to laugh. So implementing things in our life that can bring us that laughter. And thinking of the whole self and self-care, thinking not just of those little things. Like we always think exercise, I need to self-care, I'll go do yoga, I'll go for a run, I'll drink more water. But it can be anything from a support group to taking a class, for going for a walk in the woods, by sitting by the ocean, by going to a cultural event, by doing something socially, even, whatever that looks like, setting work to home boundaries, breathing real air. For those of you that are in masks all day, think about that first breath of real air when you walk out of your place of work, at the hospital, the clinic, the agency, wherever you are. What is it like to take that first breath of real air? And if you work someplace in an environment where you can't just walk outside easily and do that, find a place where you're able to, like if you're in the car, open the windows, feel the air, things that bring on that moment of just kind of being rejuvenating and building you back up. Meditating, visualization activities. And in today's world of COVID, these are great things to do. A lot of this we talked about. The doom scrolling is one of the better ones to avoid. Not just sitting there and doing this on your phone constantly. Honestly, I have some of my clients will either get rid of their social media apps, not everybody can do that, or moving it somewhere else on their phone, because we'll go to that one place every time, right? We'll go to hit that, move it, and think, do I need to look at that now? Or can I do something? Can I go for a walk? Can I stand up? If you have pets, pets are a brilliant way to sit and kind of decompress for a while, to go spend time with an animal. Find those healthful behaviors that bring you into that real moment. And if you feel that you can't do it on your own, or you feel that being able to talk to somebody is going to be important, reach out. The Emotional PPE project, emotionalppe.org, is real. We're not the only game in town. There's a lot of people providing services out there for healthcare workers impacted by COVID. And almost everything probably in your job right now might not be directly because you worked with people who were impacted by COVID, but a lot of it is COVID adjacent. So the reality is that there are a lot of us out there that want to be there to listen, to talk to you, to be a part, and to give you that moment to be able to really make this about you for a while. So please reach out. Please ask for help, because we would like people to know they're not alone in this. And I suspect through many of you had a same shared experience, could identify with the same kind of emotions and feelings. So ways to connect with each other will be equally as important. So that is me. I hope that has been helpful for some of you. Britt, I don't know if there's anything else from anyone out there. I took my full hour. Wow. Okay. There's Britt. Hey, Britt.
Hey guys, hey. Yeah, so that was super great. I hope that you guys got any and everything you need because it was amazing. If you guys have any questions at all, you can just drop them in the Q&A. I know it was a lot of information. I will be sending out the recording and the slides and everything. So don't feel like if you missed something, or, you just want to go back and kind of like ponder on some things, I'll be sending everything out. But if you have any questions for Kimberly or me or anything, we're here and ready for whatever you got for us.
Absolutely. And I'm happy to share my slides if that would be helpful for people. If you just, but go ahead and let Britt know if you want just the slides, to remember, please do. I'm happy to share that. So, otherwise, I know
We just have some thank yous. I don't think we have any questions. I think people are like trying to take it in.
it's a lot. I'm sorry. I throw so much at people. I hope it wasn't too overwhelming.
No, it's great. It's great. We need it. We need it. You know what I mean? I think we're all appreciative just to have the space to know, hey, we're going through something. we're all there and it's okay. Yeah, we're just getting a lot of thank yous. So I think everyone is good. I think you just literally nailed all the information and you know what I mean? I don't think we have any questions.
Only my
See? It
sisters.
wasn't too much. They appreciated it. It was great. I told you. It's just, we just want to feel supported and loved on. And I think that that's what this was for. You know what I mean? So
You guys deserve the same love and care that you give others. So bring it.
amen, amen. Well, we appreciate you guys again for showing up and showing up for yourselves, most importantly. So we just really, really appreciate you. And like I said before, definitely here for you if you want to email me or anything. If want to reach out for anything, if you need more resources, tips, or anything like that, or like we said, we link the Emotional PPE project, especially I will be linking it again within the email that you guys will get. But please do not hesitate or anything to reach out to me. Okay. Um, I just love all of these responses. They're great.
Reach.
Everyone's just saying thank you and they appreciate you. And this is everything they needed. They're going to work on controlling their situations, their environments.
And reach out, in doing that, controlling your situations and environments. If something comes up and you really feel you want somebody to talk to, reach out to Emotional PPE, see if there's somebody in your state we can connect you with. And if we don't, we'll help you find somebody in your state that might be able to talk to you, because you shouldn't be alone, none of you. So
Amen, y'all. I sought help. So if that gives you guys any like clarity, I sought help. I'm not up here, just preaching to the choir. No, no, no. I have a therapist that I see every week. So it's okay to seek help. It's okay to, say that you're not okay. And I just want you all to know that this is a safe space. Trusted is a safe space. I am a safe space. Kimberly is a safe space. If you're still nervous, like if you want to have a barrier before you reach out, I am here for you guys. Okay. So we thank you again. You guys make sure you stay safe out there and make sure you reach out if you need anything. I'm like a mom, like y'all don't y'all email me. So yeah, we just thank you, Kimberly, again, and we thank everyone for showing up. We appreciate you guys so much and happy holidays. All right. Happy holidays, everyone.
thanks for
Um,
having me, you guys. Thanks for all you do.
no problem. You guys have a great night.
Bye.